Previously on MDA.
Simon, what's happened to you?
Looks to me like a lateral twisting injury to the ankle. It's a common bushwalking injury. Slipped on a damp, rocky surface. I say he fell outwards onto the right-hand side of the ankle and strained the lateral ligament.
You got all that just by looking at him?
We had coffee downstairs.
I told her we couldn't go camping.
She was obviously unimpressed.
What kind of father am I anyway? I can't give up a weekend to take my family camping.
Jason, why do you think it's so hard for your father to understand how you feel?
He doesn't talk about any emotional stuff or things that he wanted much or that life was a struggle.
We've had enough of this Freud business for the time being. I've got to get back to the office.
I hardly ever saw you. You were always working.
Do you think I had any choice?
All you ever did was whinge about how much you spent on us, the school fees, the orthodontics.
I wanted the best for you.
Bill, just listen.
Don't you see, I couldn't give a shit about going to a private school. I didn't care about having crooked teeth. All I ever wanted you to do was to spend some time with me. Yeah, I don't know, to say, come on, Jace. You bat, I'll bowl. But you never did. You were always too busy. And that's why I'm the prick that I am.
I never said that.
Oh, come on, Dad. I'm your worst nightmare, aren't I? Unreliable, layabout, unmotivated parasite. That pretty well sums me up, doesn't it? I piss you off, right? I'll be honest, that's what we're here for. My behaviour, my ingratitude, my attitude gives you the shits.
What gives me the shits is that I gave you 1,000 options and you have taken none of them.
What options? Go to university, become a nice middle-class lawyer. Those are 2 options, the only ones you gave me, and they don't interest me.
No, I'm totally aware of what your interests are, Jason.
You wouldn't have a clue what my interests are.
Bullshit!
Bill, I think the last few sessions have actually provided ample illustration that you don't have much of an idea of what Jason's real interests are.
You've come to berry season, not to praise him.
Why do you always come up with that bullshit?
Morning.
Morning.
Are you okay?
Not really, no.
I thought the ankle was getting better.
The ankle was, Jamie, and then I overcompensated, and now my knee is paying the price.
Overcompensated.
The ballet last night,
One grand jeté too many?
one flight of stairs too many. The bells were ringing, we were rushing up the stairs.
It's time you gave up these extreme sports, Simon.
And do what, Jamie? Stay at home with my leg up watching reality television.
Works for me.
Nice one.
I, on the other hand, intent as I am on making the most of each unforgiving minute, spent the evening at the gym.
I've heard gyms are great places to meet interesting and exciting people.
That's an urban myth.
Planning on reforesting the entire state, are we?
Didn't expect to see you for a while.
Why?
Didn't really mean everything I said the other night. Sort of got on a roll.
Well, that's the whole idea, isn't it?
I may have gone too far.
Now you cleared the air.
Any checks?
Jason, I think it's about time you changed your address, don't you?
Yeah, I will. I get somewhere permanent.
Yeah, that looks like a parking fine.
Mum usually...
I know the little scheme you two have got going. You get the fine, she pays for it and says it's her fault.
Yeah, a couple of times.
Well, the pleasure's going to be all yours from now on. That, my friend, is a letter from the university.
Gee, thanks. Just what I need.
Oh, Jason, for Christ's sake.
Dad, I'm not interested in uni, OK?
I realise that. I was more worried about your bowling action.
Bullshit. Thanks for the stuff.
Your mother wanted me to ask you if you'd like to come over for dinner one night.
You gonna be there?
Just for the eating and drinking part, yeah.
Let's not rush the relationship, eh?
Thank you.
Fluid build-up, extension painful.
Yes, I know. Torn cartilage.
Book yourself in for an arthroscopy. Tear that bad, it's 6 to 1 they'll repair or resect the meniscus.
Arthro lottery, Jamie. I end up with arthritis. I never bushwalk again.
Chances of that are pretty remote. As it is, you can't bushwalk anyway.
Time heals all wounds.
Yeah, that's good, coming from a surgeon.
I'm just going to rest it for a day or two and I'll see how it goes.
You're just afraid to go to the doctor.
Don't be ridiculous, Amanda.
Typical male response.
You're probably right. Arthroscopy's probably just a waste of time. I'd amputate above the knee and be done with it.
Call Sarah Christie. She'll do it with her axe.
Oh, thank you.
Morning. How bodes the new dawn?
Simon's a cripple, Jamie admits to watching reality TV, and Amanda's a gym junkie.
Well, to each his own.
You okay?
Thank you. I will be as soon as I find the right salve for my lacerated self-esteem.
Jason?
I'm reliably informed that the therapy that I'm participating in is making progress.
That's good.
My son called me a self-centered arsehole.
Coffee?
Thank you. Yeah, I'm told that he's saying things he could never say before. He's
Right.
purging deep-seated anger, evidently.
But taking it out on you.
Alfano says it's a necessary step along the path to reconciliation.
Do you believe him?
It's a bitter pill to swallow, but I must admit it is the longest time that Jason and I have spent in a room together since he entered adolescence.
Can I help you?
I'm here to see Amanda Mackay, Hugh DeVere.
Sure, I'll get her for you.
Jamie, what do you know about X-ray dye?
Correct term is contrast medium.
You're hired. You got a minute for this meeting?
Have I got time to read the brief?
Just fly with it, Jamie, baby, just this once. Dr. DeVere is a radiologist, saved a woman's life. Now, wouldn't you know, she's suing him. Dr. Hugh DeVere. Hi, I'm Amanda Mackay. Come through. Dr. Jamie Lawless, Dr. Hugh DeVere.
How do you do?
Oh, good.
Step inside.
She became very flushed. Pulse was 120, throat swelling, breathing restricted. Left unattended, she'd have been dead in 10 minutes.
But she wasn't unattended, she was in your clinic.
Exactly, yeah, I knew the drill. I injected adrenaline, gave her oxygen. She came good within 5 minutes.
So this woman, Ms. Silvani, she was referred to you by her GP because of recurring headaches and episodes of dizziness.
BP normal, had to be something causing it.
Okay, so she came in for a routine CT scan. You injected the contrast medium. She got a burning rash, trouble breathing, abdominal pain, diarrhea. She was in a bad way.
Well, we wanted to keep her for observation, but she took matters into her own hands. If she walks out the door, what am I going to do? Hold her prisoner?
This dye can kill you.
If you're extremely allergic to it.
And you don't warn people of this?
Allergic reactions are rare. When they happen, they're usually just minor skin rashes. This woman was a 1 in a million occurrence.
MDA will argue that their member responded appropriately and advised you to rest in the waiting room.
I believe the correct term is observation. But if sitting me on a plastic chair in front of the receptionist is what passes for medical observation, no wonder we're getting sicker.
Penny, they claim you sat for an hour, then took yourself into hospital.
You go in for an X-ray. They tell you it will take 20 minutes, so out of experience you schedule an hour. Finally, they inject you with something. They say there's nothing to worry about, but right away you feel very strange. Within 2 minutes, Barley Belly looks like a case of the hiccups. 5 minutes later, there's Dr. Cheapskate standing over you with his adrenaline injection, and you're returning from a near-death experience.
And they didn't warn you that there was any risks associated with the injection of the contrast medium, nor did they ask you if there's any previous history to an allergic reaction.
Only if I'd been an asthmatic. I nearly died.
He failed to take into account your highly distressed state.
So I took myself off to hospital, thank you very much, where I stayed for another 8 hours. At least I wasn't sitting on a plastic chair being observed by the work experience receptionist.
So there was a better dye available and Penny Silvani didn't get it?
Non-ionic dye. Significantly less than 1% incidence of reaction.
What's the catch?
4 times more expensive. Unnecessary for a routine scan.
If I had to peel myself off the cold, hard toilet floor with my knickers around my ankles, I'd say hang the expense.
No one gets the choice. Routine X-ray dye, 5% of people may experience some nausea or redness of skin, and of that, a minute number suffer anaphylaxis.
DeVere's aware of the risks and yet he says nothing.
She should have been transferred to hospital.
DeVere had her under observation. Given the fact that she didn't lose consciousness and he administered an adrenaline injection, he dealt with it as he saw fit.
And he charges her for a successful procedure. And despite the after effects and reluctance on her part, DeVere convinces her to have the scan.
Plaintiff's claiming $20,000 for general damages and $20,000 for lost income.
For a day's work?
She's a real estate agent, wouldn't you know? DeVere's cheap dye cost her the sale of a penthouse.
Tragic.
You're a doctor, what would you do? Choose the regular or the super?
At a quarter of the price, I'll take the punt on the common or garden variety.
It's a routine dye, everyone's using it.
O'Connor? No, because he's an idiot. I wouldn't let him touch me. I went through med school with him. OK, well, if you think of anybody else, then please let me know.
You actually haven't been on the receiving end before, have you?
I'm sorry?
You've never been a patient.
Now, I have every faith in the hospital system.
Wait till you view it from the other side.
Meaning?
Meaning endless waiting, rude staff, infections,
I
misdiagnosis.
think you've got the wrong century, Amanda.
But then you'll be right. You just tell them you're a surgeon, you'll get the red carpet
That's
treatment.
not the way it works.
Of course.
It's not.
Jamie Lawless.
Any problems of catastrophic proportions emerge in my absence?
No, you should go away more often.
Don't tempt me.
Dr. Alfano called. He says he needs to talk to you. It's important.
A complaint has been laid against me with the medical board.
Against you? On what grounds?
I've become involved with a former patient.
What, physically?
That's the allegation.
Is it true?
She was formerly a patient of mine.
Did you have a relationship?
I've never had a physical relationship with the patient.
Why is she bringing this complaint then?
A connection developed.
What, beyond the normal therapist-patient connection?
Yes.
OK, the woman in question.
Her name is Siobhan Ray. Right now, we're just trying to get some perspective.
Perspective? For Christ's sake, John, a woman's bringing a complaint against you to the board. What more perspective do you want?
Well, I didn't intend for this to happen. In fact, if you'd come to me 18 months ago, I would have said it could never happen. I'm sure she won't go through with it.
My husband died in a car accident. Before then, our marriage was undergoing difficulties. We were both alcoholics.
When did you start seeing Dr. Alfano?
After my husband's death, I was severely depressed.
And Dr. Alfano helped you with that?
I'd seen several psychiatrists. I was drinking heavily and addicted to antidepressants. Dr. Alfano helped me cope without these things.
When did the relationship change?
I spotted John at the pictures. I was with a girlfriend. He was alone. I could see he was trying to avoid me. I thought it was odd and I raised it at our next session. John explained he preferred to minimise contact outside the sessions.
Do you think that was a good idea?
I felt I understood at the time. After that, he behaved differently towards me.
In what way?
He seemed nervous, shy, as if he had feelings for me and he was trying to hide them. I asked him about it and he ended the session. Then 2 days later, he called to tell me he couldn't have a relationship with me.
Yet he did.
Yeah.
While you were seeing Dr. Alfano, did he show any physical affection towards you?
No.
Yet the relationship did become sexual.
Not immediately. He referred me to another psychiatrist, Dr. Mitchell. He said we needed to get some perspective. I didn't understand his attitude. For a couple of weeks, we had no contact. Then he came round to my office. We had sex that day.
Did you have sex?
Not when she was my patient.
How long after she was your patient?
2 weeks, maybe 3.
What were the circumstances in which you first had sex?
She called me and she asked me to come and see her at her office. She runs an importing business, Mexican clothing, knickknacks, that sort of thing. So I went to see her to tell her that that we had to make a clean break.
So you went to see her to tell her that you couldn't see her?
And she got upset, locked the office and dragged me into a storeroom.
So you reluctantly made mad, passionate love among the ponchos and sombreros?
It was wonderful.
Siobhan, you've certainly done the right thing by bringing this to the attention of the medical board. You must understand that I cannot represent you at the hearing.
I understand.
If the board decides in your favour, I can certainly assist you in a civil action against Dr. Alfano.
That's what I wanted to know.
It was Dr. Mitchell who suggested you bring this complaint, correct?
Yes, she was outraged.
And Dr. Mitchell suggested you see me?
Yes.
I know Dr. Mitchell. We use her as an expert witness.
Mitchell's a good psych, but she's occasionally prone to outbursts of evangelical self-righteousness.
In which case, why would you refer Ms. Ray on to Dr. Mitchell?
She expressed feelings for me and I wanted her treated by the best.
So in other words, you referred her on, not because she was developing feelings for you, but because you were becoming sexually attracted to her.
We were mutually attracted to each other.
Jerry.
Bill, you want another witness report?
I wondered if I might run something past you involving a member we're representing.
Oh, yes?
Dr. John Alfano.
It's not appropriate, Bill.
No, I do realise that you have an interest in the case.
It's more than an interest. The complainant's my patient.
Am I to understand that you suggested she raise the matter with the board?
I made no such suggestion. I merely informed my patient of the ethical ramifications of Dr. Alfano's behaviour. As a result, she chose to make a formal complaint to the board.
Okay. Well, that clarifies the issue.
I trust you didn't approach me in the hope of gaining confidential information.
Of course not.
Look, the fact is, John Alfano abused his position as a patient who held him in very high esteem.
Which he denies, of course.
Oh, does he also deny continued harassment of his former patient with countless phone calls, while at the same time refusing to take any calls from me?
When was this?
It's still happening.
I see.
Yeah, but what you don't see, Bill, is the extent of John Alfano's dishonesty.
Did John Alfano ring you? He said he was going to.
No, what about?
He's in a bit of trouble.
What sort of trouble?
Well, I can't say, really.
Don't you know?
No, of course I know.
Tell me.
It's confidential,
He's
Jason.
my therapist. What's he done?
Oh, possibly nothing as yet.
Don't play lawyer games with me, Dad. What's he accused of?
Having a relationship with a patient.
A sexual relationship?
Yeah.
Can't believe he'd be that stupid.
On that, we are in accord.
I need him, Dad.
I know. 3 leading psychiatrists will attest to John Alfano's professional integrity.
But not Jerry Mitchell.
Dr. Mitchell holds Alfano in very low regard.
So who's the board going to believe?
Can't answer that. I don't know who to believe myself. Mitchell claims that Alfano's still trying to contact his ex-patient.
What's Alfano's story?
I've yet to ask him that.
I thought screwing a patient was always a no-no.
A former patient, he refused to get involved while he was treating him.
The man's a saint.
Well, is he married?
Well, after he told his wife that he had feelings for his former patient, she threw him out.
And he's distressed.
Well, marriage was on the rocks for years. He gave her an excuse.
The stats on your colleagues you requested?
Thanks, Layla.
What's this?
Bit of private research.
Simon wants to be sure he's in the best of hands.
The knee, I'm going for an arthroscopy.
Better you than me.
Yes, I'll just put it through.
Excuse me, Richard. Dr. DeVere just called. He's running a bit late. Typically sloppy.
I'll see you in there.
I know you.
I don't think so.
Didn't I sell you a house?
No.
Do you want to buy one?
Not right now.
Apartment, near beach. Should we get started?
Let's keep blood flow to the right part of your anatomy.
Is this where I get my life-saving medal?
I'd plan on being disappointed if I were you.
It's It's a routine dye. Everybody's using it. It's a routine dye.
May I speak with Mr. Goldsmith, please? What problem?
Hip replacement went badly wrong. Huge settlement.
No, actually, no, that's fine. I'm sorry. I'm sorry to bother you. Bye. Okay, what about Jack Wiggins?
He's a clean skin.
And a garrulous bore.
Well, you will be unconscious.
I should be unconscious, depending on the anaesthetist.
Do you want me to look up anaesthetists too?
There is an alternative, safer product, and it was not offered.
For more than 95% of patients, standard ionic contrast medium is safe.
Well, Amanda, that makes 5% for whom it is unsafe and potentially lethal. That is Penny Silvani.
How can you know what you're allergic to until you've tried it?
Miss Silvani was not warned of the potential.
She was asked whether she was asthmatic, those most likely to suffer adverse effects.
Any responsible doctor would have thought it warranted a warning.
I couldn't breathe. My skin was on fire. I collapsed off the toilet seat where I'd made a stinking mess. I was humiliated and frightened.
Here it is. A doctor has a duty to warn a patient of a risk inherent in a treatment if a reasonable person would attach significance to it.
Well, what is your assessment of your client's claim?
I assess the claim at $20,000 for general and $20,000 for loss of income.
My understanding was that Miss Silvani was only away from her employment for 1 day.
Enough time for her to lose the sale of a penthouse apartment.
Must have been good.
2% of $1.2 million. How's your arithmetic?
24,000.
Quick.
And you're only claiming for 20,000. Thanks for the discount.
Total claim, Jamie, 40,000.
Not even in the ballpark, Richard.
What price would you put on a near-death experience?
We might have to concede no warning, but not what she claims for general damages. She undermined Devere's duty of care when she walked out of his rooms.
If we're conceding no warning, that means patients should routinely be offered a choice of dye. 20,000 starting to sound reasonable.
Who pays your salary?
Statistics, Amanda. Richard's right. If this went to court, we would get rolled. Penny Silvani puts a face to the risk, and we've lost on much lower probabilities. Anyone hearing her will think it's significant she'd be warned, significant she'd be transferred to hospital.
15,000.
Is MDA looking for a concession on pain and suffering?
Dr. Devere recognised and treated Miss Silvani in a timely and appropriate manner and kept her under adequate observation after the attack. Responsible, not negligent.
My client should have been transferred immediately.
Keeping his client in the clinic was a prudent decision.
Jamie, it was a life-threatening ordeal. Penny Silvani has suffered nervous shock, humiliation, anxiety, pain and suffering. She should have been warned. She should have been given the option of a safer diet, and she should have been transferred to that hospital immediately.
Miss Silvani disappeared without notice. From that point on, she was on her own, Richard.
Oh, come on, Amanda. Standard of care? She was left on a chair under the supervision of a receptionist. Now, any intelligent person would have taken matters into their own hands.
She shouldn't have been driving.
That twit should have called me an ambulance.
Miss Silvani...
There was no need.
Oh, I knew there was a reason I didn't pay your bill.
Failure to warn, pain and suffering, and a resultant loss of
I'm
income.
a complete mess, and he insists on going ahead with a CT scan.
The contrast medium was in your body.
It was only sensible to make the most of its presence.
Almost killed me.
But it didn't, and the adrenaline was effective. Dr. Devere saved you the trauma of having to endure a second dose of radiation dye.
Your response to MDA's offer,
It's not
Richard?
good enough.
Dr. Devere acted in your best interests.
Well, that's supposed to make me feel all warm and fuzzy.
20,000. That's my final offer.
And you can't fit me in? That's terrific. Jack, thank you very much. I'll see you in the morning.
Don't forget to take your PJs.
And why would I need my PJs, Layla?
Well, what are you going to do, recuperate in the nude?
It's day surgery.
When I went in and had my appendix out, I was in for 3 weeks. Complications.
Okay. I'm having a minor procedure. A small fibre optic telescope inserted through incisions approximately 5 millimetres long. I'll be a day patient with the entire procedure performed under the comfort of a general anaesthetic.
They make it all sound so relaxed and carefree on the webpage, don't they? Medical Defence Australia, Layla speaking.
I'll get the paperwork over to you tomorrow.
And a circular to your radiologist members advising them to warn their patients may be in order as well.
Very thoughtful suggestion, Richard.
All part of the service, Amanda.
That was surprisingly painless.
Wasn't much to argue about.
Would you like to have a drink after work?
I'm not interested in buying anything.
I won't be selling anything.
It's probably not the done thing.
All the more reason, don't you think? Give me a call.
Okay. Thanks. We need to get radiologists to give patients a choice.
It's just what Richard said. What was that all about?
What?
You and Miss Silvani?
Just real estate?
Uh-huh.
Morning.
Morning.
Finish this sentence. Radiologists should be having kittens now because...
It was severe.
Thanks, Jamie.
Your failure to warn gets us every time.
And Devere's post-trauma treatment of his patient did nothing to help his cause.
Maybe Dr. DeVere should do one of our classes for clinicians in dealing with the public.
A recognition that his patients are also human would help.
Happy? Dr. Alfano's here.
Right. Sex I was prepared for, now we've got calls.
Siobhan withdrawing like that after I'd referred her to Mitchell alarmed me.
Didn't you understand I don't want to see you anymore?
I was concerned. I'm responsible.
I asked you if you'd had contact with her, and you said no.
There's been no contact because she won't take my calls.
Didn't you think that calling her may aggravate matters?
No, I was more concerned about the treatment she's receiving. I'm worried she's back on antidepressants.
Hasn't it occurred to you that your harassment may be the very reason that she is back on antidepressants?
I'm weaning her off those drugs.
And replacing them with what, with you?
Look, it's Mitchell.
I beg your pardon.
Mitchell is feeding Siobhan's dependency.
Hang
It's
on.
wrong.
She is not your patient,
It was a huge
John.
mistake referring
Agreed.
her to Mitchell.
Let's just back up here. Let's rewind. Your mistake was crossing the boundary from appropriate clinical behaviour into a behaviour that is totally unacceptable.
No. Mitchell's distorting it.
I expect your colleagues would see it in the same light as Dr. Mitchell.
The woman is on a crusade.
So, you're saying you didn't have an affair? That the accusations are just a fabrication of Dr. Mitchell's?
Mitchell has got it in for me.
You admitted to calling her. You told me about having sex in her office.
I love Siobhan.
Make it 9 o'clock. That'll give us an hour before the hearing starts. Yeah, at the board, the most important thing is for you to demonstrate insight into your conduct.
Sorry?
You're going to go in there and you're going to say you're sorry. You're going to admit to everything and you're going to convey regret to the board.
All right, I will.
If you prevaricate or obfuscate like you have with me, you're stuffed.
Sorry, Bill.
Don't apologise to me. I'm simply your advocate in this matter. You apologise to Siobhan, to the board, to your peers, and to whichever deity in the heavens you believe in.
You're right, I will. I've been a fool.
On that note of self-awareness, may we move ahead?
Feel like a drink?
No alcohol for me.
I got other plans, thanks.
Like what?
Like plans I intend keeping to myself.
Since when did you become a man of mystery?
I have hidden depths, Amanda.
Really? How's it looking for our besieged psychiatrist?
Worse than Jericho. The walls are about to come tumbling down.
Have you found out who initiated the relationship?
Does it matter? He was her psychiatrist.
But there was a relationship.
More than that, it's possible they may need each other, but reason not the need in the eyes of the powers that be. The man has transgressed.
Well, he must have known he was playing with fire.
Yes, but he still went ahead.
Why?
Simple. He says he loves her, as if that absolves him from his multitude of sins. I can't fathom the man, having seen him as I have with Jason, a brilliant, astute therapist, and then to learn about this folie à deux of a relationship he's got himself into. It's hard to believe it's the same person.
Good luck.
Thanks.
I've been an MDA 2.5, 3 years, but no, not straight out of med school.
Are you worried someone might see you, Jamie?
No.
With me?
No. I did all the usual residencies as well. Emergency, neurology, renal obstetrics.
Yeah, slow down, I'm not going to bite.
Okay, sorry.
And you were good too, I bet. But you look too young to be a doctor.
Thanks.
Oh no, that's when you know you're getting old. I mean, the cops and doctors look way too young to be cops and doctors.
You're not that old. I mean, you look terrific.
I know. I know you think so. First time you saw me.
Yeah.
Do you have a girlfriend?
Not at the moment. There was someone, a doctor, but
A
she's...
simple yes and no will suffice.
No.
I'm amazed. What is wrong with your generation?
I don't know.
I mean, you're obviously very sweet.
Ah, sweet. I've heard that before. I know what that means. You're very sweet, but...
Not in my case, Jamie. Would you like to get some dinner?
Yes, I would.
Do you mind too much if we head in? Oh.
You all right?
I don't know.
How many drinks have you had?
Just the one. Just come over all dizzy.
This is why you saw Dr. DeVere.
Yeah, every now and again it hits me.
Penny, you really should see someone, run some tests.
I wouldn't mind if we took away and check on dinner.
Sure.
So, I had that thought. Whatever else you were thinking.
In fact, why don't we get you over to St Albans right now?
Now? Start at 600 and see what they come back with. My guess is they'll open at 550. Bye.
Your doctor's waiting for you to pass some urine into this so she can run some tests.
More tests?
Something's causing your dizziness.
She's being very thorough.
She doesn't want any negligence claims.
Touché.
Whoa, whoa, whoa. If you walk out of here, you are catching taxis from now on. And I'll be very disappointed that someone so informed is being so reckless. Okay, fine. I can't hold you prisoner.
Didn't they want me to feel that?
Yes. Good idea.
I will have questions after I've...
I'll try and answer them.
You couldn't rustle up something to eat, could you? I'm starving.
For you?
You're my hero.
The best the kitchen has to offer.
I don't care what this is. What is this?
Something not pureed. Eat up. I'll come back when you're finished.
Oh, sit. I hate dining alone.
It's moments like these I get all warm and fuzzy.
You really want to save people, don't you? Hey, Doctor, I peed in a jar for you.
Yes.
For a second, I thought you were getting all wishy-washy on me.
I've made an appointment for you to see a specialist.
More tests?
Just a process of elimination. You should have an MRI.
What for?
As a precaution. 95% of the time, it's a perfectly benign explanation. Problems are rare.
Hey, I'm rare. How many people have a reaction to X-ray dye? Give me another statistic.
99% of patients polled think that that's chicken.
What is it?
Fish.
Thanks, by the way.
Just deal with the issues in as straightforward a manner as possible.
Of course.
Don't try and shift blame. You're going to have to take it on the chin.
There's Siobhan. She doesn't look good.
Can I say neither do you? Do you think you might be able to focus your undoubted intelligence on yourself for just 1 minute? This is your future at stake here.
Sorry to keep you waiting. How are we today?
We are a bit cold.
Won't be long. Just have to ask a few questions. Any recent fever or chills?
Nope, all clear.
Boils or skin abrasions?
I can assure you my general health is
Irritation of eyes, ears, throat or gums?
is very good, mate.
Any stomach or intestinal illnesses?
No, as I said, my general...
Diarrhea?
No.
Nausea and vomiting?
No.
Blood in your stools?
No.
Smoker?
No.
Any allergies?
No.
Any problems with urination?
No. And I'm not pregnant.
And have you had anything to eat or drink in the last 12 hours?
No.
Very good. Right, we'll just take your blood pressure and pulse.
How do you know I'm telling the truth?
Well, we don't. We just have to ask.
I'd been to a couple of psychiatrists, but they seemed unable to help me. I heard about Dr. Alfano arranged a referral and he began treating me.
When was this?
About 18 months ago.
Are you still being treated by Dr. Alfano?
No.
Why's that?
Dr. Alfano helped me when no one else could.
You haven't answered the question, Ms. Ray.
We started having feelings for each other.
And what did Dr. Alfano do about those feelings?
Dr. Alfano referred me to another psychiatrist.
But that wasn't the end of your relationship, was it?
No.
Have you had sex with Dr. Alfano, Ms. Ray?
Not while I was his patient, but we did after that.
On more than one occasion?
Yes.
Any recent fevers or chills, Simon?
No, as I've already explained to the nurse.
No boils, skin abrasions, throat irritations, problems with previous anaesthetic?
No, I've actually already answered these questions, Ned.
Can't be too careful, Simon.
No, that's right, but I can assure you I'm in pretty good physical shape.
You're having an operation?
Yeah, well, apart from my knee and my ankle.
I'll be giving you a drug to help relax you.
Diazepam.
Nice to know a surgeon's au fait with anaesthetic procedures.
Yeah, you really don't have to read me the first-time user's manual, Ned.
No, but I do. In here, you're my patient. I'm going to treat you like every other patient. So can I finish my shtick?
Yes, you were about to explain the anaesthetic.
Yeah, which I'll introduce through a small needle in your arm. You won't feel anything. When you wake up, you may feel groggy for a few minutes, but this will soon wear off.
Thank you.
Any questions?
How do you feel about Dr. Alfano at this point in time?
I don't know.
And why is that?
He was very good for me. We had something special. But he shouldn't have done what he did.
And what was that?
He shouldn't have made it complicated.
How do you mean complicated, Ms. Ray?
It was inappropriate. He was my therapist. He crossed the line.
Do you think Dr. Alfano's behaviour caused your depression to get worse?
With due respect, Mr. Chairman, I do not believe that is the issue.
I think that's for the panel to decide, Mr. Henderson.
Ms. Ray, is it true to say that Dr. Alfano was instrumental in helping you overcome your depression?
He was brilliant.
Thank you.
Ms. Ray volunteered this information about her relationship with Dr. Alfano?
Her relationship with Dr. Alfano had become very dependent. When her therapy was discontinued, she became terrified of being alone. And we discussed this, and she revealed that the previous day, Dr. Alfano had visited her at her office and they'd had sex.
What was your reaction?
I was alarmed. I immediately sought to verify her claim with Dr. Alfano. He has never returned any of my calls.
In your professional opinion, what impact has this relationship had on Siobhan Ray?
The relationship was conflicted, leaving her increasingly depressed.
She claims he helped her depression.
His initial treatment does appear to have been effective. But once an intimate relationship started, she regressed rapidly.
Oh, bullshit.
You blame Dr. Alfano for Ms. Ray's regression?
His behaviour has been extraordinarily unprofessional. He has allowed his lust for this woman to destroy any chance that she had of making a recovery from her grief-induced depression. But she referred her to me, purely, it seems, to clear the way for this sexual relationship he wanted. He then aggravated her confusion by exploiting the therapist's authority in having sex with her, and then withdrawing, and then harassing her with phone calls. He has, by his behaviour, completely destroyed Miss Ray's self-esteem and compounded her already deep-seated emotional problems.
She needs me. It's Mitchell who screwed her up. Just save it, will you? Why do you think Dr. Alfano referred Ms. Ray to you in particular?
He knows of my work with depression.
Did she complain to you about Dr. Alfano?
She informed me of the situation.
In the form of a complaint?
Not as such.
She told you, I gather, about the first time that they had sex?
At her office, yes.
And is it your understanding that this sexual encounter was consensual on her part?
What, leaving aside the implicit power inequities associated with a psychiatrist and his patient?
She didn't accuse him of raping her, for instance.
Not literally, no.
In other words, two consenting adults with strong feelings for each other had sex.
No. A psychiatrist and his patient had sex.
She was no longer his patient.
In my view, once a patient, always a patient.
Another view is that Dr. Alfano took every step he possibly could to do the right thing by the woman he loved, even to the point of referring her on to you, knowing as he does your attitude on such matters.
Well, that would have been all part of a death wish on his part, it would seem.
Dr. Mitchell, did you advise your patient to lodge a complaint against Dr. Alfano?
I advised her that she had that option. It was her choice to do so. She asked me how, I told her.
Could it be possible that this relationship had a future?
Of what kind? No. Is it possible for a psychiatrist and his patient to fall in love? Undoubtedly. But as you know, Mr. Henderson, there are guidelines which forbid psychiatrists from acting on these feelings. And you know why.
What's going on?
Hi, Amanda.
Layla said you rang, wanted some case notes to read.
Yeah. Thanks. I was expecting a courier.
Oh, I said I'd bring him over. On lunch.
Thanks. Yeah, I just seem to be hanging around here, so I thought I'd...
Why? You've been here ages.
Yeah, well, my little procedure isn't exactly life or death.
All the same, eminent surgeon.
Yeah, well, a huge road accident rather took precedence. There's nothing much to see.
Oh, I don't know. Simon Lloyd in a silly hospital gown? Why do they use them?
It is a garment which allows some concession to modesty and yet provides instant access.
Funny they're not more popular then. Anything else I can get you?
I don't think so, no, thank you.
No, right. I better get back. Any idea how much longer?
None. Thanks.
No worries. See ya.
Part of your treatment was to reduce her dependence on medication, is that correct?
Yes, it was my opinion that the antidepressants were masking deeper cognitive and emotional issues. As Siobhan began to come to terms with her grief and the disabling nature of her guilt, we decided to reduce her reliance on antidepressants.
And would it be true to say that much of your treatment involved working through Ms. Ray's feelings of guilt?
Yes. Siobhan's guilt arose substantially because of her inability to bear her husband a child and the strain this placed on their marriage.
Could you describe when your relationship became personal?
As we reduced Siobhan's medication, her personality came more into focus, specifically her capacity for personal insight and a sense of humour. These traits formed the cornerstone of her recovery, and I found myself attracted to her.
Was this a concern for you?
Of course, she was my patient.
And what steps did you take to deal with this situation?
I immediately referred her to Dr. Mitchell.
And was it your intention to break off all contact with Ms. Ray?
It was, but neither of us wanted that.
You can speak confidently for Ms. Ray on this also?
Yes.
Can you tell me why you didn't consult your colleagues?
I didn't think it was necessary. I'd made sure that Siobhan was receiving appropriate care.
So you chose to ignore the guidelines, in other words?
I didn't think they applied in this case.
Why did you pursue the relationship with Ms. Ray?
Siobhan is a very special person. I began to realise that she was important to me.
Dr. Alfano, you are aware of the ethical guidelines governing relationships between psychiatrists and patients, aren't you?
Yes, I would never engage in a sexual relationship with a patient.
However, you did.
Not when she was my patient.
You abused her.
Please refrain from commenting, Dr. Mitchell.
I did not abuse Siobhan. I loved her. I love her still. I know it was a serious error of judgment, but I needed her and she needed me.
Would you say Ms. Ray has a dependent personality?
Yes, I would.
And that in therapy she became dependent on you?
She was dependent on drugs before she came to me.
And she transferred that dependency to you?
No, we grew to love each other.
You mean you exploited that dependence?
I was there for her and she clung to me while she was recovering.
She was dependent on you.
No, I wouldn't let her. That's why I stopped treatment and referred her to Dr. Mitchell.
Do you think that was the only mistake you made?
No, now Mitchell's got her teeth into Siobhan.
What does that mean?
Dr. Mitchell.
You've exploited Siobhan's dependency for your own purposes.
That is completely
Dr.
outrageous.
Mitchell.
It's true.
Dr. Mitchell, if you can't sit quietly, I'll have to ask you to leave the hearing. And Dr. Alfano, you'll limit yourself to answering questions from counsel assisting the panel. Thank you.
I had no idea it would be like this.
These things can happen.
I want to call it off.
What?
I want to withdraw my complaint.
No, Siobhan, you can't.
It's my complaint. Why can't I?
Because now the matter has been raised, the board is aware of the situation, it is too late. The horse has already bolted.
He's going to be crucified.
He's behaved badly.
You don't understand.
Dr. Alfano has not sought to rationalise his errant judgment, but I will. The public need to be protected from predatory clinicians who repeatedly seek sexual advantage through the manipulation of trust and abuse of power. That is not Dr. John Alfano. Dr. Alfano's judgment lapsed during a period of great stress associated with the breakup of his marriage. This episode was uncharacteristic of Dr. Alfano, who offers his regret and has demonstrated deep remorse at this hearing. The public does not need to be protected from this man. Dr. Alfano's specialist skills are often the last chance for many who pin their hopes on his counsel. I urge you to allow Dr. Alfano to continue in practice.
Thank you, Mr. Henderson.
Penny.
Hello.
Hello.
Dr. Lawless.
Ms. Silvani,
I feel like a pincushion thanks to you.
did you get the results?
Nothing serious related to the migraines I've been getting. Though I would like a second opinion.
I'm honoured.
Got a cab waiting downstairs. You want to walk me?
Sure.
You getting in?
Don't want to let all that back seat go to waste.
That all seemed to go all right.
Mm-hmm.
You had a bit of a wait, but these things happen.
Mm-hmm.
Now, have you got a friend or someone else to pick you up?
I believe I do have a friend, as it happens.
I'll take him, thanks, nurse.
Good. You're welcome.
I asked earlier. They said you were in a wheelchair.
That's just for tonight. I've got the crutches for tomorrow.
Is it hurting now?
I think it's about to start, but, got drugs.
I'll get you home. Is that okay?
Yes. Thank you.
Thought you might have some problems with stairs and things, so...
It's very kind of you, Amanda.
Sure. You hungry?
Very.
Restaurant or takeaway?
I don't really feel like going into a restaurant like this.
Takeaway.
Simon!
Layla! I've got something to show you.
I hope it's not colour photos.
No, it is my meniscus.
Yuck.
It's beyond repair. I'm flapping around like a retired footballer's.
Were you treated well?
I was treated fine.
But
I had to answer a lot of stupid questions, and I was kept waiting for 2 hours in a hospital gown. I was freezing cold. The magazines were all absolutely ancient. I had to endure an inane lecture about post-operative care.
So, no red carpet treatment?
Well, just normal treatment, I suppose.
Coffee?
Yes, please.
Did you let on you're a surgeon? He certainly didn't get this kind of treatment as far as I could see.
Hey, sorry about just crashing out on the couch last night. I was...
Don't worry. I put it down to the after effects of your minor procedure rather than my failure to sparkle.
That's exactly right. And Amanda, thank you again.
Anytime.
Jamie Lawless. You look exhausted, mate.
You want to know the trick with crutches?
Go on.
Take the weight on your wrists. The armpits are only there to anchor the device. They're not load-bearing.
Well, why didn't they explain that to me?
You're a surgeon. They assume you already know everything.
Well, it's a fair assumption.
What?
It is the determination of this panel that the medical registration of Dr. John Alfano be cancelled, effective immediately. This hearing is now concluded.
You do realise this strengthens your hand into civil proceedings?
No, I can't. What have I done?
Siobhan, you've got no reason to feel guilty.
I'm terribly sorry, John.
Well, it's liberating in a way. Siobhan. Siobhan.
So, what's the greater purpose here?
Bring some colour into a dull world.
Got some bad news, I'm afraid.
Psychiatrists of the century get wiped out.
Yeah. I'm afraid so, I'm sorry.
It's not your fault.
He was his own worst enemy. Do you mind if I relax and watch your work for a while?
Unlike you to relax.
Alfano wanted me to return this to you.
Did you read it?
Robin Boyd's never been my favourite architect.
It's interesting, though. A man of his time. Hold on to it if you want.
You going to see someone else?
I don't know.
It's your call. If you need to speak to someone...
I am speaking to someone.